Hello, my name is Valerie, and we're going to be doing a musculoskeletal assessment today on the patient. Uh, First off, we're going to start off by inspecting the shoulders. We're going to go ahead and take a look for any asymmetrical. They look symmetrical right now, no abnormalities. Go ahead and shrug your shoulders. Okay, we're going to assess the back as well. We're looking at the scapula. There's no deformities, no masses. Nothing looks abnormal. She's sitting in the upright position. She's straight. We're gonna, after inspecting the outer aspect of the shoulders, we're gonna go ahead and move to assessing the range of motion. Assessing the outer aspect of the shoulders for any atrophy, deformities, any swelling in the back and the front. We'll go ahead and move on to assessing range of motion. So we're gonna ask the patient to do a couple of movements with her arms. We're gonna go ahead and ask her to do flexion, which is raise your arms up. Okay. And then if you could stand up and then go ahead and bring them down. We're doing extension there. Go back. There you go. And then now we're going to do abduction. So go ahead and extend them out. And then bring them in. So you're adducting right there. And then now we're going to do the internal and external rotation. So go ahead and lift up your arms like in showing your muscle position. Go ahead and rotate them down. That's internal and external rotation. Any pain or tenderness? No. Okay, range of motion of the shoulders is good. You can go ahead and take a seat. Okay, now that we're done with the shoulders range of motion, we're moving on to the elbows. Let me inspect the outer aspect of the elbows. Sorry, go ahead and lift up your shirt. Yeah. Okay. Everything looks fine, no deformities, no swelling of the elbows. We're gonna move on to range of motion of the elbows. So I'm gonna ask you to flex the elbows this way and then extend. Any pain there? No abnormalities noted to the range of motion of the elbows. Now we're gonna go ahead and extend them out. And then that's pronation there. Go ahead and rotate them outwards. That's supination. Again, do it one more time. Okay, no abnormalities, no pain there. Now moving down to the wrist and hands, we're gonna take a look at the hands. We're gonna inspect the wrist, the fingers, the bones. Let me go ahead and take a look. There is no abnormalities, no swelling noted. Her fingers look fine, no deformities. Since we're already here at the hands and assessing the fingers, we're gonna go ahead and assess the wrist and the range of motion of the wrist. Go ahead and do flexion of the wrist, which is forward, and then go ahead and go up. That's extension. Any pain there? No? Okay. For the wrist, we're also gonna do what's called ulnar deviation and radial deviation. Go ahead and extend your arms. You're gonna rotate your in and out. Okay, that's abduction and adduction of the wrist. No abnormalities there. Range of motion is good. It is not reduced. And we're gonna go ahead and take another look at the fingers. And go ahead and stick out your thumbs. We're checking for flexion and extension of the thumbs. Move them back and forth, in and out. And then go ahead and send your fingers out again. And then just in and out, bend them. Okay. The fingers, we look at the MCP, PIP, DIP, which is the outer top. Everything looks fine with the fingers, hands, and wrists. We're gonna go ahead and move to inspect the patient's spine, starting off with her posture. So I'm gonna ask you to go ahead and stand up. Turn that way. Okay, she's standing in the upright position, shoulders are back. There's no obvious abnormalities just by inspecting. We're gonna assess the cervical area, the thoracic area, and the lumbar curves, both laterally and in this position. We're we're looking at the iliac crest. We're going down, and the gluteal folds. Her posture looks fine. Now we're gonna assess the range of the motion. So we're gonna go back up to the cervical spine. We're gonna ask the patient, let's see, turn sideways to your side. We're assessing cervical spine range of motion. Go ahead and lean your head forward. Okay, that is flexion of the spine. Go ahead and go back. That is extension of the cervical spine. Go ahead and rotate side to side. Any pain there? No pain in the back?
No.
Okay. Go ahead and do lateral bending, which is side to side. Perfect. Any pain there? No. All right, then. So that's the cervical spine range of motion. Now we're gonna do like the full thoracic spine range of motion. I need you to stand up, face one way, and then go ahead and lean forward. That's flexion of the spine, no abnormalities. Any pain there?
No.
Go ahead and sit up and then go back, extend. Okay, no abnormalities there either. And then go ahead and rotate. Now face me, and we're gonna do lateral bending side to side. Okay, no abnormalities with the range of motion there. Okay, we're gonna go ahead and inspect the patient's stance. We're looking at her pelvis area, their base, the width of how she's standing. She's standing upright, base and width are appropriate. Now we're gonna inspect knee flexion while she's walking and stride length. So go ahead and take a few steps. Okay, stride length is normal, no pelvic shift. Knee flexion is normal upon walking, no abnormalities noted in her gait. Go ahead and come back over here. Turn that way. We're gonna continue to assess the spine. No lordosis or scoliosis noted. Length and symmetry again is fine. And then we're gonna do hip range of motion. Go ahead and face sideways, and then go ahead and like you're kicking forward. Let me see to assess your hips. Let's see, go forward, your hips. Okay, that is flexion. I'll go back, extension. Okay, and then lift it up and rotate out. Okay, flexion, extension, and then rotate the hips in and out. Okay, good range of motion to the hips. Good stance, good gait, and overall good range of motion. No problems with the spine, hips, or her gait. We're gonna go ahead and take a seat again, and we're gonna continue with the knees, ankles, and feet. Okay,
So
now we're gonna go ahead and move to the knees, ankles, and feet. We're gonna inspect the knees outerly. We're gonna assess for any deformities, no swelling. The patella looks fine. We're assessing the quadricep muscles, normal, no atrophy, no bruising. We're also gonna do range of motion of the knees. Go ahead and put them back, like bend back. Flexion and then extension. Perfect. Okay, now go ahead and lay down. We're gonna go ahead and move to the ankles and the feet. We're gonna assess the feet for any deformities, no swelling, no calluses. Go ahead and point your toes forward. We're extension and flexion. Good range of motion in and out. Any pain there? No? Okay. Range of motion to the ankles and to the feet is perfectly fine. That includes the musculoskeletal assessment from shoulders all the way down to the feet. Thank you. Okay, so today we're going to be performing a neural exam on our patient. And we're going to start off by testing the 12 cranial nerves. We're going to start by testing cranial nerve number 1, which is olfactory. We're going to ask the patient to close their eyes. We're going to have her smell an object or item, and she has to tell us what it is. So go ahead and close your eyes. What do you smell? Lemon? Yes, good job. We're gonna go ahead and move to cranial nerve number 2, which is the optic nerve. And we're gonna use the Snellen chart to test for visual acuity. Go ahead and look that way towards the chart. Okay, go ahead and cover your left eye. And then go ahead and read this line for me. D-E-F-P-O-T-E-C. Okay, good job. Go ahead and cover your left eye, cover your right eye. Go ahead and read it. The same line. D-E-F-P-O-T-E-C. Perfect. This patient has 20/20 vision. It's different over here. Okay, now we're going to test cranial nerve number 3. We are testing ocular motor. We are going to test for perla. Okay. Just go ahead and look at me. Okay. One more time. Okay. Pupils are equal, round, and reactive to light. Nothing abnormal noted there. We're going to go ahead and move on to cranial nerve number 2, which is the trochlear. We're going to assess for eye movement, down and laterally. So go ahead and take a look at this pen and go ahead and follow it, okay? So move your head. And then we're going to go laterally. Last one. Very good. Okay, that was cranial nerve number 4. We're moving on to cranial nerve number 5, which is the trigeminal nerve. It tests for facial sensation. We're gonna have the patient close their eyes, and we're gonna touch them with a cotton ball and ask them to say now whenever they feel the cotton ball. Are you ready?
Yes.
Go ahead and close your eyes.
Now. 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 Now.
Okay, cranial nerve number 5 is intact. Moving on to cranial nerve number 6, which is abducens. Once again, we're gonna check for eye movement laterally and diagonally. Go ahead and look at my head. Perfect. One more time. Perfect. After this, we're moving on to cranial nerve number 7, which is facial. So it tests for facial expressions. Go ahead and frown. Go ahead and smile. Okay. Close your eyes tightly. Puff your cheeks. Perfect. Cranial nerve number 7 is intact. Moving on to cranial nerve number 8, which is vestibular cochlear. We're going to test for hearing and balance. I'm going to cover your left ear. Okay. Left. Okay. Now cover the other one. Right. Okay. Good job. Testing for balance. Go ahead and stand over there. I'm going to have you walk. Take a few steps. Okay, good job. Patient has a steady gait, no loss of balance noted. And you could go ahead and come take a seat again. That was cranial nerve number 8. Go ahead and open your mouth. Say ah, and then swallow. Okay, and then I'm gonna test your gag reflex. Okay, moving on to cranial nerve number 10. We're gonna once again assess swallowing, and that includes the gag reflex as well, which we just did. Now cranial nerve number 11. We're gonna ask the patient to shrug their shoulders. Go ahead. Perfect. Turn your face. There you go. Now the other side. Perfect. That is cranial nerve number 11, which is spinal accessory. Last but not least, we're gonna test cranial nerve number 12, which is hypoglossal nerve. We're gonna ask the patient to stick their tongue out. We're gonna assess the tongue for any abnormalities, none noted. Go ahead and move your tongue side to side, up and down. Perfect. That concludes the 12 cranial nerve assessment. We're gonna go ahead and move on to testing. Okay, we're gonna go ahead and move on to testing muscle strength. We're gonna check the shoulders, the elbows, the wrists, the fingers, hips, knees, and ankles. Okay, so we're gonna ask the patient to either push or pull against me, and we'll test for everything. Okay, go ahead and stand up. Put your arms on the side. Okay, push against my arms. Raise up your hands. Okay, good. Now go ahead and put your arms out, and then push against me. Okay, now pull. Okay, now we're gonna do that with the wrist. Push, and then forward. Okay, move your thumbs for me. Okay, really good job. Go ahead and lay down. Do it again. Push your toes towards you. Okay, push forward. Okay, lift up this leg. Perfect. Now the other one. Okay, perfect. Okay, we already assessed the muscle strength. We're gonna ask the patient to sit up again. Or actually, well, no, never mind. Okay, we're gonna assess coordination now. We're gonna do some rapid alternating movements. This is called finger tapping. I need you to do it first with your left or right, it doesn't matter. Start tapping your finger like that. And when I tell you now, go ahead and tap the rest of the fingers. Go ahead now. Perfect, good hand coordination, finger coordination. Go ahead and do it with your other arm. Okay, now. Perfect. We're gonna do the finger to nose test. Go ahead and touch your nose. Touch my finger. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Okay, that's good coordination there too. One last test. I'm sorry, I have to ask you to lay down again. You're gonna do the heel to shin test. With your left heel, go ahead and slide it on your right shin, up and down. Perfect. Now the other side. Perfect. Okay, now once again, I'm gonna assess your gait. I need you to just casually walk over here. Okay, just take a few steps. Perfect. Now back. Okay, now you're gonna walk that way across the room, but I need you to do it on your toes first. Go ahead. Okay, now walk in your heels back. Now you're gonna do a heel to toe in a straight line, the tandem. Okay, perfect. Steady gait, good balance, good coordination. I'm gonna have you stand here. We're gonna do what's called a Romberg test. Just go ahead and stand straight. Put your arms on the side. We're gonna just stand there for like 10 seconds. Okay, now we ask the patient to close their eyes and keep that same position. And we're assessing for any swaying, making sure the patient has good balance and good coordination. And she does, nothing is abnormal. And we're pretty much done with the neural exam test. That is it for today. That completes our musculoskeletal and neuro test. Thank you.